Hello, my name is Angela Beckerman, and I am a licensed psychotherapist and addiction specialist. In my previous video, I had addressed how addiction develops and progresses. Today in this video, I am going to address how individuals and communities can prevent the progression of addiction. Addiction is a disease. It is a biopsychosocial disease. In the previous video, I had described how an individual is affected by drug use physically, mentally, socially, and economically. Like other diseases, addiction is incurable, requires medical intervention, and also requires long-term care. When a physical dependent person wants to stop using, they usually want to avoid the suffering of withdrawal, so they admit themselves into a hospital detox. After that, they may spend nights in an inpatient program, and then weekly outpatient, followed by aftercare counseling, and which includes a weekly support, a sober support group. Many people ask, why can't people just stop using? Why is all this treatment necessary? This is because the person has physically become dependent on the substance, and their lifestyle is centered around their drug use. They spend a lot of time anticipating, planning where, when, how, who they'll get their drugs from, and also the time they spend using the substance. Treatment addresses the lifestyle changes, changing thoughts, feelings, behaviors, as well as managing urges. Part of this is learning relapse prevention skills, as well as building a sober support network. Relapse prevention strategies include avoiding high-risk situations, people, places, and things associated with their drug use. Also, structuring and balancing their time with work, rest, sober fun, and attendance to a sober support group. And lastly, it's very important to have a sober support network. This may include participation in 12-step programs like NA and AA, or church attendance, or attendance and participation in a meditation or meditation or yoga group. Relapse. Someone may be sober through and after treatment. They may have days, weeks, months, years of sobriety, but they may relapse, and their relapse or return to drugs or alcohol may be triggered by boredom, negative feelings, high-risk situations, old or new stressors, or memories of drug use or traumas. That's why it's so important to be involved and always be part of a sober support network, because these people can help you recognize your relapse triggers and provide you the support that you need for your recovery. People all wonder, what should I do if I find out that my family member or loved one is using drugs? They are often tempted and want to control the drug use of their loved one. So they continually confront the individual, look, find, and throw away their drugs, or follow them to make sure they're not using drugs. These methods usually do not work. However, it is important that you do not enable your loved one who's using drugs. Enabling means that you're either taking away their consequences, making excuses to others about their behavior, and also fulfilling their responsibilities. Examples of this would be a wife calling her husband's boss, giving excuses for his absence, or a father bailing his son out of jail just after being arrested for possession of drugs, or a friend loaning money to a drug-dependent person to pay their bills. What's also very important is that the loved one attend Al-Anon, so they learn how to take care of themselves and support their loved one who's using drugs. People ask, what are the warning signs? What should I look for if I think someone is using drugs? First of all, you'll find that they're missing for hours or parts of days. They may be having mood changes. For example, they may seem more anxious, depressed, or angry. They may act aggressively or impulsively. They might be starting to isolate from others. Behaviors. You may see a change in their friends, and there may be also a change in their performance. For example, academics or work. Also, they may stop fulfilling their family and financial obligations. As for a community, it's important that addiction be approached in a way that recovery people can respond. As citizens and professionals in the community, we can address addiction in an educated, non-judgmental, and empathetic way. Addiction is not bad, unlawful behavior of the immoral, uneducated poor that should be punished. Rather, drug use is often unintentional behavior resulting from the physical, emotional, and behavioral symptoms of an unforeseen disease. Most people who become addicted would never have stolen, prostituted, assaulted others, or put themselves or families at the risk if they did not have the compelling urges of their physical dependency. So what can communities do? They can throw away the stereotypes and avoid punitive measures. They can provide education to professionals in the community as well as education to their citizens. They can provide access to resources and services. They can create and implement an annual budget that will fund these services and resources. And to start with, they can start doing statistics of who and why certain populations in their community are using and which substances or drugs they are using. I hope that you have gained an understanding of addiction. I hope you have enjoyed observing this video and that you have learned the signs of addiction, how we can prevent addiction. Also, from the first video, how addiction develops and progresses. I welcome you to share your experiences or suggestions, but be aware that this is a public forum. Thank you, and I hope you enjoyed this. Have a good day.